Hello, everyone. It's a pleasure to be here to talk about oral health in age-friendly health system. We start with, let me just get my clicker going. Okay, excuse me for that couple of minutes of pause. I need to start this with a couple housekeeping items. The opinion expressed in this presentation are those of the speaker, which is me, and not necessarily those of UT School of Dentistry at Houston. This presentation was made possible by a grant number K01HP33459 from Health Resources and Services Administration, also known as HRSA. It is an operating division of the U.S. Department of Health and Human Services. So HRSA has offered us this grant and has done greatly for oral health within an age-friendly health system. Also, the opinion expressed in this course should not be construed as an advice to care for a specific patient. Lastly, neither I nor member of my immediate family have any financial relationship with commercial entities that may be relevant to this presentation. With that, let's get to our objectives. The objectives that I put it in 3 objectives, but it's basically 2 if we want to talk about it in that format. It is just how to integrate oral health within a 4Ms, because currently it's not integrated. But the oral health, as we all know, is a big part of overall health. And the fact is that at the end of these presentations, you're going to know that as a non-oral health providers, how do you see or how do you recognize abnormalities in the mouth or in overall oral health? The first poll, I just have this question that I had to ask you all. Do you think oral health education is sufficiently taught in all health professional disciplines? Do you feel you can just look in the mouth as you're doing your baseline assessment? Do you think you can lift up the tongue and look at underneath of a tongue, or look at the gums and look at the teeth? And even if people do not have any teeth, do you look at how their gums look, or if there is any anything that's abnormal? Any abnormality means lesions, means redness, means too much plaque, it means soreness, anything and anything that you can find in a mouth that looks unusual. And believe me, looking at all these pictures that I've put in, we don't have to be dentists to see something is wrong here. And that's all it's about. How to recognize abnormalities. How do we define oral health? Back in 2016, there was a definition, but by Dr. Michael Glick and his colleagues, that they put it in kind of 3 different tiers. And these tiers, it kind of covered everything, is a multifaceted, included abilities to speak, smile, smell, taste, touch, chew, swallow, convey. If you really look at this whole thing, you can see that every single of those things it's named is a part of a healthcare. If somebody cannot chew, somebody cannot swallow, the lack of taste, lack of smell, muscle expressions that causes this smile. So all these that in a way is a definition of oral health. It definitely is not separated or divided or aside from overall health. So looking at this whole thing, I just added the RX to it, which is by our definition is medication. However, let me get my laser point here. However, when you look at these three here, even though we are trying to put it in a 4 components, is not exactly what our 4 M's talk about. So what it means in its perfection form. In its perfection form, the 4 M's becomes the main structure, which is what matters most: medication, mentation, and mobility. Bringing this oral health in, put it in this structure, or take this structure and put it in oral health. By the end of this presentation, you'll see how relevant and how related this can be. So let's start with what matters most. What matters most happens to be the umbrella arcing over the other three, meaning medication, mentation, and mobility is not going to take us to the final stage, which is the clinical outcome, without what matters most. And why is that? Let's say I, as a dentist, make these beautiful teeth for somebody, and in my eyes, they look beautiful. They're white as snow. They're straight and square, and they're perfect. Of course, I don't make teeth like that. But if patient looks at me and I said, I don't like this, they look like chiclets. So I didn't meet the criteria of the 4 M's here. What patient wants, I shouldn't say patient, what individual required and their expectation is actually what makes the clinical outcomes be desirable and proper. The one thing you have to keep in mind is what matters most is not something we ask initially and just follow that as a roadmap. That doesn't work that way, because you have to, that might change from visit to visit, time to time, every couple of months, especially if you're seeing somebody every 3 months, 4 months, even once a year. And why is that? Because what matters to people at the given time is based on the conditions and circumstances at the given time. Let's say at some point, your individual that you're meeting in your office, the main thing is that she or he wants to be able to smile or want to go out, have a better social life, or is just starting dating, or whatever else that can be. In about 3 months, they come back to see you. Sadly, they had a stroke, and they have some kind, now there are more medications involved, now there is mobility involved, that there is the whole what matters most at that, in this circumstance and at this time, it definitely is very different from what you talked about 3 months ago. So checking in every visit, what matters most, that makes the roadmap to the success. For example, I have this patient, his name is George. George is a 82-year, now how old was, I even didn't put it in here. George at the time was 96, a 96-year-old man. He's homebound. He stays in his house, and he is actually cared for by his wife and a caregiver, because the wife is also older than she can actually handle George the way his needs are. So they have a caregiver. George happened to have an abscess in the gum as a result of he had this long bridge here. Something happened probably underneath, maybe a cavity or something on the root surfaces. So the teeth underneath deteriorate, start this big abscess here in the mouth, and externally, when I got the call and I went in as an emergency, this is how I found him. His face is swollen, red, warm to touch. I even noticed as a result of the swelling, even the one part of a nostril on the nose was even moved. So George is in a lot of pain, even though he's not expressing, he's not able to express. He is in a lot of pain. He is not communicable, so he cannot tell me what matters to him most. I needed to know that George needs to be off the pain. George needs to be back to functions of eating. And George, that used to be a man that would just look at you and smile, and I need to get that face back. So what matters most is sometimes you can ask, sometimes you just have to know by realizing the first thing that can jump at you that making this individual non-functional in that area. So let's talk about another case I had. How about Nancy? This is Nancy. Nancy was in a rehab, a nursing home for the rehab right after a bad stroke. So Nancy, you saw this picture earlier. I had to use this case only because, as you can see, if you see this tooth is longer than the rest of them, it's out of place, it's out of space. And when I touched it, and you can touch it too, it's when you're doing assessment, doesn't mean exam, doesn't mean diagnosis, is just assessment. Assessment, if you touch this tooth, the tooth is going to move. So the assessment says tooth is mobile. We don't have to call it the tooth number, the front tooth, the back tooth, top tooth, bottom tooth. Whatever it is, it needs to be noted as a baseline assessment to come in. And if there is this unusual redness, of course, in some areas you can actually see a little bit of blood. All these are things that do not need a dentist to be there to see. These are the assessments that any health professional can be and should be able to assess as we assess the patient initially to bring him into the system, and know if we see something odd or something abnormal, where to go. So that's all it's about, bringing oral health into the forams and into the age-friendly health system. And once you start paying attention to this, you will actually see that more than you can imagine of elderly, especially the ones with more chronic sicknesses, with more medications, with any more cognitive decline, they have more and more of oral health issues.